Okay. Got it.
All right. Hi, I'm Dr. Carol Petherbridge. I'm a naturopathic physician here in Bend, Oregon, and I am a urinary incontinence and sexual wellness specialist. And I recently had a women's intimate health support circle in January, and I had a whole array of wonderful experts to join me for that. And one of my dear friends, Jen Miles, was part of that panel. And we're here today to just extend what was asked and created in that event. And we're going to answer a few questions and learn more about your practice too, Jen. So I would love for you to introduce yourself and tell us a little bit about your background and what kind of practice you do.
Okay. Thanks, Carol. Hi, I'm Jen Miles, and I am a pelvic floor specialist here in Bend, Oregon. I started Miles Pelvic Therapy just last year, but I've been practicing PT for over 23 years now. And I love every minute and wanted to do my own thing. And I'm really loving helping women in the Central Oregon community. So what else can I tell you about me? I'm really active Central Oregonian, like everybody here. So I love working with the active women in Bend and helping them get back to independence and feeling good and confident with all the things they do. So,
Awesome. So Jen, share with us what it's like to come to a pelvic PT. So many people understand physical therapy, but pelvic floor therapy may be new. And so let's take some of the myth out of what it means to come to a pelvic floor physical therapist.
Yes. Okay. I love that question. I think there's a lot of fear and anxiety, and I love to just calm people's nerves to know exactly what to expect. So first of all, for those, I'm right in Midtown Bend, really convenient location. I'm right inside the Easy Float building on the corner of 4th and Franklin. So I'm renting space there right now, and I have a really secure, cozy, homey office. So what we start with is sitting down in comfy chairs with our clothes on, and we chat about your symptoms and your history and what you've tried and maybe what's worked for you, what hasn't, maybe any injuries you've had in the past, or what your diet is and how you're sleeping, and kind of the whole mix to kind of feel for what you're dealing with day to day and how I can help you. From there, we might look at your posture. We might look at how you walk. We might look at how strong your hip muscles are. We're definitely going to look at how you breathe. And if indicated, a pelvic floor exam is the best way to find out what your pelvic floor strength is. So these muscles that are inside the base of our pelvis, the best way to feel and see what they're doing is a vaginal exam. But unlike an OB-GYN exam, I don't use stirrups, I don't use a speculum, I just use my eyes and one gloved finger, only if indicated, only if comfortable. And that's how we tell what the strength and coordination, intention, and tissue quality is of this group of muscles. And at the end of the day, it's just a group of muscles, and it just happens to be an area that people are uncomfortable with, but you wouldn't be too uncomfortable with checking your ankle muscles after a sprained ankle, or your back muscles after you moved a mattress and hurt your back. So it's just another group of muscles that we need to check in with and see how they're doing and their quality, and why they might not be doing their full job for you. So that exam takes about 5 minutes. So I like to say that a lot of times people think like, oh my God, I'm going to have, a vaginal exam for an hour. No, definitely not. About 5 minutes. We get a ton of information in 5 minutes, and that gives us, really helps us set our goals to know where our treatment should lie after that. And then after that, it is a combination of body mechanics, core strength, breathing techniques, maybe looking at your pelvic floor, how it's reacting on a screen. I actually have a little system that I can hook up some sensors on your skin on the outside of your pelvic floor. And you sit and stand or do lunges or lay down, whatever we're kind of looking at. And we can actually see your pelvic floor turning on and off on a screen. And once we see that, it really fast tracks your ability to connect with this area. So that might be one thing we do. I think about 5 to 10% of our time together in pelvic floor therapy might be working with the pelvic floor directly with clothing off. But 90% or more is dealing with the rest of the surrounding tissue. So I like to really debunk that. And if you're not comfortable looking at the pelvic floor directly, then we do the best we can, assessing other ways. So, and I often see patients 3 to 5, maybe 8 visits if there's a lot of pain. So this is not a 20 visit, 30 visit post shoulder rehab. This is, let's get you back out there and doing what you want to do with confidence. So is there any questions like you would have, Carol, for something I missed?
I love your focus to really moving women back to being active and getting on with their life. And I think that's a great, I've learned a little bit in your description I have a better idea of actually how you work with women now from your description. And of course, I work with the pelvic floor in a little different area. You're working more on the bowl, if you will, of the pelvic floor and the more of the structure. I am a specialist that works on the cellular and tissue integrity level. And I share with my patients that when they come to see me for incontinence or pain with sex or dryness of the vaginal tissues, that really the pelvic floor or all of these issues are multifactorial. And, I can address the tissue integrity and some of the hormone requirements. You really work with that beautiful structure, and together, that really makes an integrated solution to these aspects. So, in the past, I've seen women who come to me who maybe pelvic floor wasn't enough. So I can add that other component, or doing the tissue integrity may not be fully addressing someone's condition. So I love having you to refer to for them to really complete that process and to address all the angles, because it's rare that one particular thing will address a multifactorial problem, if you will. So
it's never one thing.
Darn it. There is no magic bullet or the silver bullet or magic one solution.
No magic button. But I do love, the puzzle, and everybody has their own, I like to call it a pelvic puzzle. And because everybody's history and bumps along the way, and just, it's so cool putting all the pieces together, and it's never the same. So that's why I love going to work every day.
Yeah, it's a variety. You have a great variety. It's not routine.
No.
Yeah. Well, from the event, we did have 2 questions that were put in our special golden basket burning questions for the panelists. And I wanted to go over these 2 questions so that when women who were at the event listen to this recording, they might say, oh, that was my question. So I'm hoping they get to listen to their answers. The first question I want to pose is, a woman asked that after a prolapsed vagina, what type of workouts need to be done so it doesn't happen again?
Okay. Well, there's all different types of prolapse, and prolapse is just a general term for when organs kind of shift out of place and fall into your vaginal, not inside the canal necessarily, but maybe into the wall. So it could be your bladder, your uterus, your urethra, or your rectum could kind of tip down. I often see a prolapse happen after birth, but I also see a prolapse might get worse after oh, by the way, I put that deck project, that deck project last summer, or we moved and we were moving for, weeks. And so after a large load that your body is taking with not good support, like sometimes a prolapse can get worse as well. So a prolapse, I wouldn't say prolapse. If you have a prolapse, it is very treatable. Just know that, and it is very manageable. But it is something you have to manage. You know, I don't want to say for life, but you just have to be aware of it. And so exactly what exercise. I can't give you those little special nuggets there because everybody has a different pelvic floor puzzle, like we said. But what we're managing a lot with prolapse is pressure. So definitely having a good breathing strategy, knowing how to diaphragm breathe and not breath holding is huge. Bowels, making sure you're not constipated and straining and
Right.
having difficulty in that department is huge, like for life. And then as far as exercise, like having good body mechanics when you're lifting and knowing how, we call it a pelvic brace, where we actually tighten or close the gates or secure your pelvic floor before we lift that heavy box or push this heavy thing. So in pelvic floor therapy, we would teach you how to brace, look at your body mechanics. And then as far as like, should I be doing Kegels? I can't tell you, and everybody hates that answer, but sometimes a prolapse happens because things are too weak, and sometimes a prolapse happens because things are too tight. And until people are assessed, I just wouldn't be doing a good job if I would just guess. So,
I have a lot of patients, probably like you, Jen, that ask me, they say, well, I've been doing Kegels, or I got this machine, or I have this device or something that does Kegels for me. And that's something that I've learned as I've gained more experience with pelvic therapists too, is that concept that it's not always weakness. Sometimes it's too much tightness. And maybe you'll agree, it seems that especially women that do a lot of very particular activities like horseback riding or, there's certain sports.
Sure.
What's the other one?
Any impact sport. Sure.
Yeah, that can actually be too tight, and learning to have that release and relaxation is just as important. So yeah, the good news is there's lots of options. The bad news is it's not a one size fits all. So we can't say, eat, it's not like drink water, eat vegetables, get sleep, and exercise. Like those are all givens, right? Sure. We don't have quite that list as clear with pelvic therapy.
Yeah. So if you have a prolapse, anybody out there, like, I just want you to know, like, it is very treatable and very manageable, and pelvic floor PT can decrease prolapse grade by 25 to 30%, which doesn't seem like a lot, but it will make you not feel it actually, if you have, if you kind of do the work and we work together as a team. I had a patient this winter already. She discharged around Christmas. She came and saw me in September. We saw each other once a month. She had a surgery scheduled in November for prolapse repair. And actually I saw her in September and taught her how to put her pessary in correctly. And that's another conversation that we might not have time for. We put her on a strength program. We released muscles, and she canceled her surgery because she had 0 symptoms. And she is off living the good life and playing sports and doing Pilates and loving life after 5 visits. So that's, I can't say enough about just getting an assessment and seeing where you're at if you have a prolapse. So much we can do.
That's awesome. I mean, that's great news. So the other question that is a situation that you and I have in common with the patients that we both see is I struggle with having my vagina tear during sex, even with lube. It gives me a lot of anxiety, help. And as I mentioned earlier, we have tissue integrity issues, and then we also have structural issues. So obviously well, maybe not obviously, but hormones are a big factor in tearing. And I see menopausal women that have very thin, friable tissue that tears easily and can cause a huge amount of pain. And a topical biestrogen biased bioidentical cream can be a game changer in 2 or 3 weeks. So there's simple fixes or hacks, if you will, that direction, all the way to why don't you share a little bit about what you see with patients that have tearing and pelvic pain and pain with sex, and how you can help women with that.
No, I agree. Like, this is like right in your lane, Carol, because it's a lot. The tears is like, I would definitely check tissue quality, hormone, balance, first and foremost. Also, there's kind of this triangle like around our main parts, right around our vulva, and a full like great, just layer of muscles that encapsulate this whole area too. So I would definitely make sure that those muscles have length in them to accept our partner or toy or finger, and we need that to have good sex, is we need to open those gates. And sometimes when you're anxious about tearing, you're not going to open, you're actually going to close the gates, which is just this loop, we need to help you get off of, unfortunately. And it's hard and it takes some time. So I would definitely, muscle tension can definitely contribute to tears because of not opening those gates, like I said. And then there's also a whole, possibility of some derm conditions, like dermatological conditions, that, if you are not in a hormone changing environment and younger, you might be dealing with a little bit of a condition as well. So I would say tight muscles, tissue quality, hormone balance, and rule out any dermatological things as well. So those are all, with the tears. And I'm assuming this patient, or sorry, not patient, this person, this gal is actually being able to see the tears and not feeling them up inside, but more, I'm guessing, at the opening. Is that what you're guessing?
Well, we could just assume and answer this question in a number of ways. The tears can be deeper within the pelvic, or deeper in the vaginal canal, which to me would lend my thought to really needing some hormone and tissue support. And you bring up a great topic, the dermatologic conditions. And I'm really passionate about getting information out to women about lichen sclerosis, which is a skin or topical dermatologic condition that affects the vulva. And it's very, it's progressive. It tends to be a lightening or whitening of the tissue, and the tissue gets dry and itchy and can be painful. And so generally the medical solution for that is to use a topical steroid cream. But as women may not be aware, long-term use of a steroid cream tends to make the skin and the tissue thinner and more susceptible to topical infections, or it's not a great long-term solution. It can help change the symptoms really quickly, which is great to get some relief. But I've begun to see a number of patients with this condition, and the thing that's so distressing is lichen sclerosis sclerosis means like scar tissue or adhering, and I'm starting to see women that the what's called the clitoral hood, it's like a little flap of, it's almost like the foreskin on a male's penis, but it's over the hood of the tip of the clitoris. And these tissues can actually start to fuse closed. So the clitoris underneath no longer can be accessed directly. And it really dampens it's like it's like having sex with a hoodie on, right? And what's distressing to me is that some of the women that I see are younger. meaning, they're not menopausal, but they've been diagnosed with this and they already have that stage of tissue change. And they haven't really been fully informed about what that really means or what the condition is. And I feel compelled to help them and to enlighten them to the importance and I look at these women in their 40s and I think, my gosh, you have 20, 30, 40 years of being sexually active, and you have this progressive condition that's really going to impact the quality of your sexual function. So share your your input, and because I think this is my new cause, if you will. Yeah. Besides keep your panties dry and your vagina wet, I want to make sure women understand that if they have friends or family that have lichen sclerosis, look for alternative answers, because topical steroid cream is only going to go so far and does nothing to really repair and regenerate and recover and return function. So how do you help women deal with that tissue aspect? Because we've shared a few patients together.
Yeah. Well, like we talked about that loop, when you're anxious about accepting your partner or sex, or having pain, you're going to guard. So I'm again after those muscles that get too tight. And when the muscles get too tight, they're going to restrict blood flow in the whole area, because all our arteries and veins are going through this tissue. And if they're going through tight tissue, like the roadway is going to be blocked a little bit. So again, I'm after those muscle releases and teaching people how to relax and giving them a good breathing strategy and a good stretching strategy to get into the fascial lines of this tissue as well. And yeah, can we talk more about talk more about sex?
Yes, let's talk more about sex.
Okay.
I'm sure we'll have some great interest from our listeners about that topic.
Yeah, because I think we know that sex is a good thing, right? We know that it's good for our heart and our sleep and our stress level and our self-esteem and obviously our partner relationships. And what am I missing? Pain,
immune system, all of it. Yeah. Endorphins.
Yeah.
Oxytocin. Yeah.
Right. All the things. So there, and this is another one of my, I just want to spread the message to the world. But we, first of all, sex should feel good. And I think that sounds really simple, but I think that's not common knowledge. And about 40% of women are having pain with intercourse, and that is way too high.
Wow, so that's a huge number.
Huge.
Right. So you're standing in line at the grocery store, and there's 10 women and four of you are having, four of us are having pain with sex. That's an epidemic, really.
It is an epidemic. So whether it's lichen or the muscles are too tight or, a history of abuse, unfortunately, or tissue quality or pH balance is off, or, there's so many reasons, but they're also so manageable and treatable. So I think people are afraid to talk about it. They don't do anything. They're scared to talk to their providers or friends or family. And then maybe you didn't have a relationship for a month, and then it's 6 months, and then it's a year, and then people think it's too late. And I, again, with postpartum and with painful sex, it's not too late. Okay. So there's so much we can do. So I think we need let's go back to the clitoris, right? That hood, whoop, whoop, right? So when we tighten our pelvic floor, it pulls the hood back off our clitoral head so that we can get more lovely, nerve endings exposed. And if that is scarred down or tight or vaginal atrophy post-menopause, we can do things about that. If your muscles are so tight that they don't want to accept a partner or a toy or a finger, we can teach those muscles how to relax and you to relax and just be more aware of that area and give you a ton of strategies to help. And if the tissue quality is out of balance, you go see Carol.
Right. And then we regenerate
Right, and we regenerate.
I do vaginal facelifts and
Right.
repair and regeneration of tissue. Yeah.
Yes.
Well, I love that you started to talk about something that I know both you and I want to get that message is that it's never too late. And it's
Mhm.
also, I have patients say, oh, I wish I hadn't waited so long. So
Mhm.
it's that balance between don't wait and it's never
Mhm.
too late.
Yeah.
So how
Yeah.
would you like
Okay.
to share about that?
Well, I was just talking to somebody about a patient that I discharged yesterday morning, and I love this story. So since it's fresh in my brain, um, her daughter gave her a Christmas card. It said, "You are going to pelvic floor therapy. Call Jen. Um, you've been dealing with this long enough." In the Christmas card, she brought it to me. The
Wow.
daughter's from Seattle, found me on Google, knew pelvic floor might help her mom, and actually, like, got her in the right direction. Um, she's 60 something, her daughter's 30. She's having leaks, and what is it, February 8th? She came and saw me after Christmas, and she discharged yesterday with her symptoms 90% better. And she's like, I know I'm going to get even better, but I think you gave me all the tools. I'm good to go. I'm just going to keep doing this and get better. And I'm like, okay, let's let you run free and go out, live life. But the point is, she is 64, I think. Her, has been dealing with this for 30 years
Oh my
and just
gosh.
didn't know that there was help or solutions or strategies. And she wasn't upset about that. We talked about it. She's like, no, I'm glad I was, basically your daughter pushed her into it. So we don't like that technique, but I thought it was cute, and she respects her daughter. And yeah, so it's never too late. There's always things to be done. And I also like to debunk a myth that I also hear with my younger moms is, oh, I'll just wait till I finish having babies to get help if I need it then, instead of preparing for birth and kind of recovering from birth in between each child, and setting yourself up for success. There's so much suffering you don't need to do, and just so much improvement you can make in the couple visits in between. So I'd love to debunk that too. So never too late, never too early. Would love to help you at pelvic floor physical therapy.
Yeah, that's absolutely true. And I love your story about your patient, and that's what makes life so exciting for us in the field that we work with, is we really do help women get their quality of life back again. I have a memorable patient as well who saw me not too long ago, who was suffering. She's in her late 70s and was at home, didn't go anywhere because she had both fecal and urinary incontinence. So she just felt homebound. I did one treatment with some PRP and some cellular biologic products with it, and literally in 4 weeks she had no fecal incontinence, and her urinary incontinence was 70 to 80% better. And she decided to move back to the, over the mountain near Eugene and go back to being around her family. So when we can make those kind of changes in a person's life, it makes us want to share it with more. And that's why at the event, I really ask that women who are at that event take what they learn into the community. So anybody who hears this information, please take this to the women in your lives and share this information and let them know it's not too late and you never can start too soon. And that women suffer a lot with pelvic issues, and they may not know where to go. And I can speak probably for both of us in this, that I feel like I'm a great gatekeeper in the sense of I can help people find resources. If I'm not the one to help you, that's why I keep networking and reaching out and creating more connections. That I know you're like that too, Jen, that, really takes a community it takes a circle of support to have a healthy body and a healthy pelvis and healthy hormones and a happy life. So I'm really honored to have you as part of my circle of experts that I can refer my patients to, and vice versa.
Yeah.
So on that note, you have had a couple events locally, and I wanted to have you share about your third and upcoming event.
Okay. Yeah, I'm doing a 3-part series at Title IX at Downtown Bend. And the third one is going to be You Deserve to Feel Amazing, peri and postmenopause, kind of tips and tricks and how to prepare if you're on, depending on where you are on that wave. And I'm going to be co-hosting with Dr. Emily Livingood, who's a naturopath in town who specializes in perimenopause as well. And we're really excited to just share information of easy things you can do at home, and also answer questions about hormones and all the things as well. And just kind of start the conversation of what is this time of life that nobody tells us about, nobody talks about, nobody asks us about. And that's why I love that you have the Women's Circle. I mean, it is amazing because, like you just said in the last comment, like it really does take a team and a community, and you are creating that by your women's circles to stand up, tell a friend, reach out and support each other and say, hey, this worked for me, or hey, this person helped me. And we need to help each other. So thank you so much for creating the space you have created at the space.
An open space, yeah. Well, thank you. And
Yeah,
if it wasn't for the community, it wouldn't be an event, right?
I know, but you
Thank
did
you.
it. So it's pretty cool. Yeah. So thank you.
I appreciate that.
Mm-hmm.
Great. Well, anything else you want to share? Last comments?
Just keep checking in. I love to teach. I love to do free education. So I've got a couple more things coming in March as well. And just, find me on Instagram. I love to do dorky videos about poo and pee and sex and all the things. So please check me out, and then you'll be in touch with any upcoming little seminars and workshops I'm doing in the community. So
Great.
that's about it. And yeah, just can't thank you enough, Carol, for hosting this. It's been incredible. Mm-hmm.
Thanks, Jen. I appreciate you so much.
Mm-hmm.
All right. Thank you.
Okay. Have a good night.
You too.